Guru Nation, thank you so much for watching or listening. Make sure you like, subscribe, comment, share. I turned ads off for you guys and gals, so subscribe. It's for your viewing and listening pleasure. Today we're going to talk about something that could be emotional. It could be soft skills involved. It could be technical skills involved. When you are managing people, this is for all the site directors, lead CRCs, anyone in a position of managing. When you are managing other people, it's not just about your technical expertise. It's about how, when people report to you, it's about how they respect you and how they feel about working for you. And I've been in this position for our 20 years now. Next year is going to be my 20th year. Actually, this year's my 20th year of doing it. Next year is like my 21st year I'm starting. And I got thrown into it. So I got thrown into a managerial position super early in my career. But as I was telling one of my staff today who's in that position, managing people is a lifelong skill set. And it's transferable skills in any industry, not just clinical research. And it boils down to a couple of things, but it boils down to respect, it boils down to compliance, and it boils down to efficiencies and teamwork. And these are these interpersonal skills that I think no matter what role you're in, even if you're not in a position of being a leader, this is something that you need to look to cultivate. And there's a really good book written by 49ers legend Bill Walsh. It's called The Score Takes Care of Itself. And I highly recommend this book. It talks about establishing a culture and then worrying about the results last. So basically the sum of the book is if you focus on the little things, and also within the context of the big thing is the culture, the mission, the values, and the culture, and how everyone else is expected to operate, the score will take care of itself. And that's exactly what Bill Walsh did with the 49ers. When he took them over, they were the worst team in the league, and he changed everything from how the custodians took out the trash to how the paychecks were presented to the players every 2 weeks, to how the receptionists would answer the phone, to how, like, all the little things, to how their jerseys would have to be crisp before the game. All those little things contribute to culture and to pride. And that's essentially what you want to do as a leader. Is if you're in a leadership role, someone's judging you on KPIs, key performance indicators. And if you're at a site, those key performance indicators are how many patients are we enrolling in studies, how many deviations do we have per study compared to other sites, how many studies are we getting. There's so many different key performance indicators that I discuss on this channel in their own videos. But when you're a leader or a site director, you that's kind of your report card. And if we use Bill Walsh's philosophy of the score will take care of itself if you fix the culture first, if you start working on the little things, those KPIs will start improving for you. And he also had another statement in that book, and maybe it's not the exact quote, but something along the lines of how you do one thing is how you do anything. So are you showing up late? Are you showing up, in his case with the San Francisco 49ers with your shirt untucked? That shows how you're doing everything. And so if you could fix the little things, the big things will take care of themselves. So when you're managing employees, your goal really is to establish expectations early on, what the rules are, why those rules are in place. I think the why is super important when managing employees. I think the why makes it easier to understand for an employee. So I use why a lot because when I tell an employee to do something, and especially when it's something new that we're trying to implement, I always have to follow up with the why. So why are we doing that? For example, we have a video tour of our clinic. Now, why do we have that? Well, we have that because we put on YouTube and we put on our website so that sponsors can see us and learn about us. Or when a pharmaceutical sponsor or a CRO goes to our website, they can see that we have a video and that we took the time to do it, because how you do one thing is how you do everything. But we also made it so that for practical reasons, so patients can actually see what our clinic looks like before they get here. So I just implemented a new policy that I talked with my director of patient recruitment, Lana, today. At the end of every text conversation with a new patient, after you go through all the do you qualify and yes, come in Monday at this time, I want you to add this site tour. And here's why. And the why is important because the why is, look, a lot of these patients already have weird feelings about who we are. We're in a non-traditional part of town where like it's off the strip. It's kind of like off the beaten path. So nobody really knows, like nobody expects a business to be out in this area anyways. So it feels a little sketchy maybe, like to a brand new patient. If we can show them the video, hey, this is where we are, this is what you can expect, it just eases that pain a little. It reduces that friction just a little bit. And that's all it takes for the patient to maybe make the difference between them deciding to come and not to come. Even though they said they're going to show up, half the time, especially in psychiatric trials, half the time they don't show up. So if we can do anything to reduce that friction, it's worth doing. So I told Lana about that today, but I didn't just tell her to do it. I told her why it's important. And that why makes it more real because now Lana understands why. It's not just because Dan said so and that's how it is. Like I'm not a dictator. I'm not a totalitarian. But now she understands and she has incentives to have patients show up because that's her KPIs that I hold her accountable for. So it shows her that I'm helping her do her job better. And ultimately, that's what you want from your staff, is seeing that you are willing to be able to help them do their job better. So this doesn't come natural to most people, and it's not an easy concept to understand because it's kind of, in many ways, you would think it's implied. Well, yeah, my employees know that if I'm the manager, like they can come to me for help. But sometimes you got to go out of your way to show that you actually mean it. And so that means sometimes going beyond just asking, do you need help? Like that's the bare minimum. Do you need help? But most employees will say no, even when they do, because they don't want to look bad or look needy or look incapable to their manager. So you really want to get them comfortable with you is the first thing. Comfortable to where they are willing to tell you, yeah, you know what, like I kind of am struggling here. It would be nice if I could have some help here. But more often than not, what's going to happen is they're going to still say no, but you as a manager should proactively kind of be a psychic and say, well, I noticed the same things for this person not getting done or getting done incorrectly. So rather than telling them every time, hey, you did this wrong or you didn't do this, and rather than just asking if they need help, I'm going to actually do it for them once and then let them know, hey, I noticed these were not done. I went ahead and did one of them. If you can do the other three, or do you have any issues getting the other three done, and what are those issues? Because now it's more pragmatic than just, do you need help? And then no, and then the same cycle repeats. Now it's, well, my manager just did my job. Like, number one, you have more respect for them. Okay, they know how to do your job. Number two, it puts the employee on alert. Like, hey, if I don't improve my own work, like, my manager is just going to do it for me. And how long are they going to actually tolerate that for? Until they start complaining to their manager, or maybe they just going to replace me altogether. So I better figure this out on my own. And that's how you get respect and compliance from your staff. At least that's been my strategy. Now, I'm a fairly typical laissez-faire type of manager, and I feel like I do a very good job of getting the employees comfortable asking me for help or telling me like how things really are going on. The parts that I struggle are micromanaging and policing, and like, there's pros and cons to everything. The pros to my strengths are, or the pros to my traits are, I get people comfortable. It's a nice working environment. I'm a fairly good motivator. The cons are, sometimes I come across as too much of a friend than a manager, and probably like not as professional as another manager might be, right? So there's pros and cons to all of this, and every manager has their own style. And I do think that if you're a manager, you're going to have one default type of style that is more natural for you to adopt. So you could be like a Jeff Bezos type of leader, where you're more of an authoritarian, my way goes. My way or the highway. Steve Jobs was like that. Elon Musk is a little bit like that. Jess Thompson, actually, from LinkedIn, had a really good post today. And I mean, partially the reason for this podcast was that post by Jess. And I'm going to actually send it to Daniel so he can put it in the video right here. But that post from Jess basically has 8 leadership styles. So the first one is autocratic, and it's Jeff Bezos. An autocratic leader maintains strict control, guiding the team with a clear vision. Bezos is known for making key decisions independently to drive consistent results. Then you have a democratic leader. This is Tim Cook from Apple. Democratic leaders prioritize inclusivity, seeking input from the team. Then you have transformational, like Elon. And then probably Steve Jobs is in that one too. They inspire progress. Musk's vision drives the team's ambitious goals forward, pushing boundaries. Then you have someone like Warren Buffett, who's a transactional leader. They emphasize clear goals and rewards, and Buffett values consistency and measurable outcomes. Then you have Richard Branson, who I'm probably closest to. I'm between him and Oprah, probably. Richard Branson is laissez-faire leader, trusts their team's autonomy. Branson fosters creativity without micromanaging. Servant leader, like Mother Teresa, prioritize the team needs. Mother Teresa created an environment of empathy and trust, inspiring purpose and respect. Then you have charismatic leader like Oprah. Charismatic leaders motivate through personal energy. Oprah connects deeply with her audience. And then you have situational leader like Barack Obama. Situational leaders adapt to circumstances during crisis especially. So these are the 8 leadership styles that you'll see underneath. And let me know in the comments which one you are. But it's honestly like we're all going to have one of these defaults. I probably have 2, and I probably have 2 more of those in my tool belt. So like I could use the Warren Buffett approach, or I could use the Mother Teresa approach when I need to. I'm probably not as good as Jeff Bezos, like being an autocrat. So the more of these tools you have in your tool belt is probably the better, because every situation and every employee that you manage calls for sometimes a different tool to be utilized, or a different archetype. And so you're going to have, as you grow as a manager, you're going to have to learn when to push harder, when to be more of a disciplinarian, when to let off, when to micromanage, when to not. So it's part art, it's part science, but ultimately it's about building a culture, and it's about gaining respect of your staff. And I really think in our industry, I think it's a must, especially at the research site level. Anyone who's in a position of management at a research site should have been a coordinator at one point. For me, that's my rule for my sites. Now, have there been cases in my career where I've let a non-research coordinator be a manager? Yes. It generally didn't work out well, but I have tried. I really think in order to get the buy-in of the frontline workers, meaning the people reporting to the manager, the person who is asking them to do things should have done all those things before and should know how to do it again, and should be willing to step in and be a servant leader when they need to, like Mother Teresa, or be an autocrat when they need to, like Jeff Bezos, which is where I'm still having issues, or be Warren Buffett, where it's transactional. Hey, look, we're going to create some incentives, or like Richard Branson, which is my default, laissez-faire, drive the creativity, but leave the staff to hire well and make sure that they're taking care of what they need to, trust that they're taking care of what they need to. So these are the tools in your tool belt if you're a manager. And when it comes to managing a site, or a CRO for that matter, but for a site, really, it's former coordinators and or current coordinators. So our lead CRC here at Yuma Clinical Trials is the most experienced coordinator who's now learning how to manage people. And it's not always easy. And sometimes there's a lot of growing pains, and you've got to learn new skills, and new skills don't just fall out of the sky. You've got to work on cultivating these skills. But you definitely want to establish culture. You want to make sure everyone understands how they're being measured, and you want everyone to feel comfortable enough to be able to approach the manager and have a conversation. And for the manager to understand and have the humility to understand, I really do think this employee has too much work going on right now, or no, I don't think they do, and I'm going to be honest with them and have a discussion on what they can do better and how I could be of assistance. So a quick short video on management. Hopefully the archetype image, you find something there that you resonate with. I'm still working on getting all those 8 archetypes in my toolbox. I probably have 5 of them. I probably need to work on a few others, but my career's, if I'm lucky, maybe halfway over. So I got time left. Like, subscribe, comment, share, Guru Nation. Let me know in the comments what you think. Bye-bye. Hey, if you guys like that kind of content, make sure you like, subscribe, comment, share. Stay tuned for more videos.